renal diseases, heart diseases. So if your fund is depleted, then the chronic and emergency funds sets in. So that you'll still have services despite that your fund has been depleted. So I think basically for me, those are the big main changes currently. The way we are doing our healthcare, we want to move from a very curative, where people just think health is gotten from the hospital. But the time people go to the hospital, you actually don't have health. You're sick. You either need to repair your health or you need now to go get back your health. Yes.
Are you a sports fan?
Yes. I love soccer. And swimming.
Let me talk to you about soccer, for example. If your job is a midfielder, say an attacking midfielder, or your job is a goalkeeper, and the coach comes and tells you, we're going to play a different strategy, a different formation, 4-4-2 to something else. And it requires, of course, that kind of change will require a tactical change as well as an operational change on the field. So if we relate that to the health systems, the health personnel, are there any changes that people should expect in how they conduct their day-to-day operations in order to allow them to execute this new mindset, this new tactic of more preventive and promotive than curative?
Yes. I think there'll be a lot of, one, mindset change. There'll also be, which I might call preparation or preparatory changes. For example, in terms of the education system, the training system, it also has to focus more on a preventive promotive, unlike what it is currently.
So wait, you mean the way doctors are trained and nurses and other health practitioners, how they're trained will have to change?
Yes, basically, we just have a more urgency and importance to more of preventive promotive. It's not that they're not doing it. They're still doing it. But what we expect is that there'll be now more focus, more impotence, and also maybe more time to the same. Of course, medical school, they go through what we call community health. They go through preventive promotive. But with the focus now with preventive and promotive, we hope, and we are working with all stakeholders, including the academia, on how we can enhance that. But also the training and the planning level during the implementation. Currently, what we are doing, we're actually reorienting the people into this primary healthcare model. In Kenya, we have what we call the hub and spoke model. Hub and spoke model, basically what we are looking at is making the facilities that are there and the different levels. We have 6 different levels in Kenya. From the community level, that we call level 1, level 2, which is more of the dispensary, most of the facilities that are next to the community. Then we have the health centers. They have more services. Now they give more expertise services.
That will be level 3.
That is level 3. Then we have level 4, which we call the current sub-county primary health referral facilities. So these are the hubs we are talking about. And we want them to link with the level 3, level 2, and level 1, so that they work as a team. Actually, what we are calling the primary healthcare network. Then this primary healthcare network will have a technical team that we call the multidisciplinary team. So that instead of people working in silos, they'll work together. So the expertise will go down. So the level 5, which is more of the referral facility, county facility, they give very specialized care. Then the level 6 is the tertiary facilities like the Kenyatta, the Moi Teaching and Referral, our spinal injury, our Madare is also one
Those
of...
at the national level, like
and
a very big level.
It's very specialized.
And it's good that you should say that, because one of the criticisms for our systems is that you find even people with common codes showing up at a national referral hospital, all of them requiring the same resources that exist there, entirely bypassing all these other levels, and sometimes for very good reason, that they're not good enough or they're too far and so on. Now, there's a concern by some people who feel that this plan might take a while to come into play fully. And that, you know, the way it's been put out has inspired a lot of confidence and a lot of hype and a lot of anticipation. And a question would emerge from such a person, and they would ask, okay, so how long shall it take, realistically speaking, before we start to feel the change in mindset and the change in approach from merely curative or priority on curative to now preventive and promotive healthcare. How long can Kenyans expect to feel the change?